Hey everyone, it's Dr. David here. I hope you can hear me. Let me know if you can hear me if you're live right now. Just type something in the chat. Let me know where you're from and just say loud and clear, or I hear you, or say hello so that I know that you can hear me. Thanks so much for joining us, everyone. It looks like we have 7 people are already on, ready to go. I appreciate you guys coming on. We're going to talk today about the top 3 risks and top 3 benefits of having knee surgery. And so I'm talking about general surgery. We could be talking about knee replacement surgery, which we're going to be talking mostly about. But this goes also for meniscectomy, like a knee meniscus surgery. This goes also for a debridement, which is like cleaning out the knee cartilage, and virtually any knee surgery, because many of them can be prevented, especially if you haven't had any sort of injury, if you haven't been in like an accident or anything like that, and something just started to progress, a more chronic pain injury is what we would call it, like arthritis, then oftentimes they can be prevented. And so I wanted to talk about that today. So before we get into it, this whole topic was spurred on by this comment from Vivian Wada. And she commented on our video called 3 Signs Your Knee Arthritis is Bad Enough to Need a Knee Replacement, which is down in the description below this video. Well, let me read her comment to you. It's interesting. I loved it, by the way. She said, I came across your video a few weeks ago. Since every video seems to drive a point of knee replacement or stoking knee replacement phobia. No one should undergo unnecessary surgery. I have current knee pain. I'm doing exercises per PT, or as a physical therapist has told her. I've seen a doctor and no signs of any arthritis. Some of your videos seem to be stoking fear with a doom and gloom messaging. This video walks back on your knee replacement pessimism, leaning more towards optimism. What percentage of those over 55 years old undergo knee replacement? Also, any causes of knee problems is being overweight or lack of exercise? And then she said, your inner knee pain video was beneficial. Thank you. And she put a smiley face emoji. So I love this. I love this so much, Vivian. If you're on here, let us know that you're here. It's okay. Do you want to remain anonymous or don't want to say anything? I love this because she's absolutely right. I do on some videos talk about how surgery isn't the answer, like I just mentioned at the beginning right now. And then there's other videos where I'm saying, hey, here's what it's going to look like if you do have knee surgery. And just to give you my standpoint, I'm going to go over some facts about knee surgeries, specifically knee replacement surgeries. Thank you, Tamika. Good evening to you. Thanks. Oh, you're from New York. Awesome. Thanks for joining us. I think you were with us last week. Thanks for coming back on. So I loved it because I go back and forth. Pessimism. She said my pessimism towards a knee replacement surgery, and then optimism. And here's my stance on it. If you need it, you need it. And I'm going to talk about exactly when you should, which is going to answer Mario Abrantes' comment. He said, Doctor, would you please begin reminding us of when there's no way out but a knee surgery? Thank you very much. And so my stance on it, though, is that it's overdone, which is beginning to be talked about more in the medical field, that it's done too soon, and it's other aspects aren't looked at closely enough or soon enough, and people are jumping the gun into surgery, whether it's their decision or they were pushed by their surgeon or peers, family members, society, culture, all that stuff. We're a heavy in the United States, and I would say probably in the Western world, we're probably very heavy on surgery as it is. And so this is a surgery that's very commonly done. So I'm going to go over the top 3 benefits and risks here in a minute, but I just want to read some facts to you first. Now, I've linked this document in the description below. This is from the CDC, the Centers for Disease and Control of the United States. And so I'm just reading you, and I wish I could screen share with you. I'm so sorry. We'll have to get that software in the future, but you can go to the link in the description for the CDC information and find the exact document that I'm looking at. And I want to read you just a couple bits here. Let me find the exact page that I was on. Here we are. This is the summary. All right. Now, this data is from 2000 through 2010, and I'm answering Vivian's question here because she's asking what's the average. Let me see exactly what she said. She said, What percentage of those over 55 years old undergo knee replacement? So here's the summary with my commentary, of course. From 2000 through 2010, total knee replacement was among the 5 most frequent of all inpatient procedures, and it was the most frequent procedure in 2008, 2009, and 2010. That means it's becoming more popular, and we're 12 years removed from that already. So I couldn't find any more updated information in my preparation for this video. There were an estimated 693,400, that's over half a million, total knee replacements performed among inpatients aged 45 and over in 2010, just in that year alone. Now, the rate of total knee replacement for men and women almost doubled from 2000 to 2010. What is it today? I can't wait to find that information for you guys one day. Among men, I'm going to skip this part because it just basically says that women got surgery more often than men. What I wanted to tell you was, here we are from 2000 to 2010. The mean age, in other words, the middle age at which inpatients age 45 and over had total knee replacements decreased significantly. In other words, people are getting knee replacements at a younger age now. And then it says, most inpatients age 45 and over were discharged home after a total knee replacement. In both 2000 and 2010, higher percentages of men age 65 and over were discharged home than women age 65 and over. A higher percentage of women in this group was discharged to long-term care facilities compared with men. So there was just more complications, and they needed more hospital care outside the normal hospital afterwards. So those are the facts. There's graphs showing you all this information, guys, and I think it's something serious to be concerned about. Now, in my opinion, it's overdone, knee replacement surgeries, but like I said at the beginning of this video, in some cases it's just severe and you need it. You absolutely need it. There's patients that I've seen here in the clinic that I've told I cannot help you. There's no amount of exercise or hands-on work that I can do here that's going to save your knee. It's just severely arthritic, and getting a knee replacement, if the surgeon is going to recommend it to you, is probably going to be the next best thing for you to do. So it's just necessary sometimes, and if that's the case, then you have to look at it. Now, the way that you decide to go get a knee replacement surgery is the risks have to outweigh, or I'm sorry, the benefits have to outweigh the risks. Because if the risks for you right now outweigh the benefits, then you shouldn't be getting a knee replacement surgery. If you're too worried about all the things that can go wrong, or all the things that might leave you in a worse situation, and the idea of the benefits, the possible positive outcomes of having a knee replacement surgery or some other knee surgery, then if the risks are more for you, you need to stop and avoid getting the surgery, and you need to figure out what other options you can do. But there are many cases where people are saying, well, if I'm going to deal with this for the next 5, 10 years, or even months, or just 1 year, they'd rather go have the surgery and risk getting all the problems that could come with it if something goes wrong. So you have to just factor that into your own situation. Now let's talk about the risks and the benefits. So the number one risk that you're going to run into if you have some sort of knee surgery is a risk for infection. And what that means is, just like, I'm sure at some point you've had an infection, whether it's been like a sinus infection, like an infection up here in your respiratory areas, or maybe you've had an infection on your skin. It's when some bacteria gets where it shouldn't be and it grows and festers. You might get pus that develops in the area, and it just doesn't allow your body to act normally in the area. It becomes painful, red. You can get fevers from it. Well, because they're doing surgery on you, which means they're cutting you open, and if you're doing a replacement surgery, then they're inserting new parts or shaving ends of bones off. It's a really involved surgery. It's probably one of the most involved surgeries you can get, aside from like brain surgery or heart surgery. But when it comes to the body, the joints, having a knee joint replacement is an enormous deal. We're just really good at it, at least here in the United States. I can't speak to other countries. But if you have to have it done, there's a slight risk that you can get an infection. And if you get an infection that isn't controlled properly, it is terrible news. I have seen patients here in the clinic that have had an infection, then what the process they go afterwards is just terrible. They can't do physical therapy. They can't begin to move very well because it hurts. They're making the prosthesis, the parts that they replace, worse potentially. And so in some cases, they have to go in and do another surgery to remove the implants. And then they put what's called a spacer, something to kind of gap the joint apart where there would be parts. And that person cannot move that leg. And they have to be like that for as long as it takes for the infection to go away. Meanwhile, they're usually, in a hospital or something, and they're getting antibiotics consistently for a while to kill the infection. And there's potential harm in taking antibiotics for a long time, of course. But it's what's needed if you've got an infection in your joint replacement. Once the infection is settled, then you're looking at having your third surgery to do the revision of the original replacement surgery, which means you're getting your next replacement. And anybody that's gone through this process, it is just a nightmare. It is terrible to deal with. And everyone that's gone through it regrets getting the replacement surgery done. I've seen people get it in other joints too, in their shoulder and their hips as well. And it's no fun. And once they learn about what we do and how we can help people without surgery, then they always make the comment of, "Oh, I should have come to you years ago." And I say, "Well, sorry, what's done is done." So that's the number one risk, is infection. The next risk, the second risk, is some surgical error, which I think probably happens a lot less in infection from what I've seen. I said I think, notice that. So it's my opinion. I don't have any stats or facts for you on that. But from what I've seen here in the clinic, I've seen occasional, what looks like a surgical error, or some, maybe it wasn't even a surgical error, but something went wrong and it wasn't an infection. The most common presentation I've seen is people that don't heal properly. And I would think that might be a surgical error. Maybe it's just the genetics of the individual, but they get a lot of excessive scar tissue right on the surgical opening, because for a knee replacement, especially, they're opening your knee wide open. If you think of your knee right here, here's the foot, here's the kneecap. They're slicing you all the way open from above the thigh, above the knee joint on the thigh, down below the knee joint to about right here. And they're folding back all the tissues. And then once they saw off the ends of the bones here and here, they usually give you a new kneecap as well. They replace everything up, then they sew it all back together. And then your job is to go and move it after that and stand and walk on it. Well, potentially the scar tissue can become too much if you don't do your therapy right afterwards. There's just so many steps along the way in the rehabilitation and the recovery after the surgery that if you mess one thing up, there's potential for having some permanent lasting effects. And maybe it's a better situation than you were in before you had the surgery. Remember, risks versus benefits. And maybe it's not. So if you didn't have that bad of arthritis, maybe you could have tolerated it longer. This is what I hear from people that have these issues, is they say, I should have just dealt with it. I should have just given up and used a cane, indefinitely, or done something else. Exercise better is a common one that I hear about. So that's another risk, is some scarring problem or the joint not moving enough, ill-fitting parts. Very rare, but it does happen from time to time. Now, the third biggest risk is, and this one happens almost all the time. I'm gonna stand on my soapbox here. Not treating the root of the problem. This is a huge deal, and this isn't the surgeon's fault. And I'll take responsibility for this. I wish this YouTube channel was bigger. I wish I could put TV commercials right after or before where the pharmaceuticals advertise, because the stuff that we preach on this channel here about treating the root problem is really the cure for knee arthritis or other knee problems that we see out there, meniscus tears, cartilage damage. But it's just not common knowledge, and it's not a quick fix, which is what a lot of people are looking for. And that's kind of what surgery is. It's a big quick fix. It's some invasive, permanent quick fix. But think about it. If you have knee arthritis and you're looking at getting a knee joint replacement, you have been compressing the heck out of your joint for years, probably decades, to the point where the cartilage is worn down. You might have a bone-on-bone situation. It's painful. You probably lost a lot of motion. And now you're going to get the joint replaced. And the original problem was never addressed. It might have been that your glute strength was very low. It might have been the way that you move. There could be some foot problem, some hip problem, maybe even a nerve or a back problem that, if not properly addressed after you have your knee replacement or some other surgery, some cartilage repair or meniscus repair, you still have that weakness. you still move improperly. In fact, it's probably going to get worse now because they cut you open and your muscles got even weaker. And now, or you're limping now from your surgery, and you're already moving bad before, you just didn't know it. Now you're going to move even worse. And if that doesn't get addressed correctly, you risk making the root problem even worse. And it's just a matter of time before either your newly surgically repaired joint is re-injured, or some other joint above or below becomes injured, like up in the hip or ankle and foot. That to me is the biggest risk. And that's what I see most often here in the clinic. Thankfully, the surgical infection rates and the mistake rates are quite low in reality. To give you the doom and gloom, Vivian, that I have to just present, what I see. This is what I see here in the clinic. But the real tragedy is not, surgical errors or infections. In my opinion, it's a widespread ignorance of treating the root of the problem that the medical field is responsible for at large. And so I take responsibility, and heck, that's why I'm doing these videos right now, these live streams, and doing this channel and operating a clinic like I operate here, because we need more people to know about this stuff and start fixing it correctly. So just to let you know, we have in the description below, in case you're dealing with a meniscus problem, a knee cartilage problem, or a knee arthritis problem, I've linked playlists to all our videos that talk about each of those three topics down in the description below. And so go check that out if you're catching this on the replay or live. Now, I'm going to talk about the benefits in a second, but let me just go over to the comments and see what people are saying here. So Tamika says, yes, thanks. Judy Beland. Hey, good to see you, Judy. She says, I was 73 when I had my right knee done, and had I not done it, I wouldn't be walking. But it was 2 years of hell healing and still hurts. And then she went on to say, I had POTS after the surgery. I was goaded into doing it. It's overdone to say the least. The balance between replaced knee and the other knee is bad, but I can't do that again. It's all about the money. She put a bunch of dollar signs. They left a stitch inside there, so they said it feels like a piece of bone. Oh, I'm so sorry, Judy, or Jude. That's really tough. And to talk about money for a second, the surgeons are a business, and to be completely fair, we're a business too. I own a physical therapy practice, and we're a business too, and we don't survive unless we have patients coming in the door that we can service and get paid for. And that's just the way that things go. But where things get rough, or it's the ethical part of it. It's the, does this person really need surgery? When people like Jude have that situation of, well, maybe I could have done without this surgery. Was a doctor just trying to meet their quota? Were they trying to make money for the business? You have to consider that. But it leaves people feeling like, was I just a sheep in the system? Was I just a pawn in the system, and I was dollar signs because I had insurance coverage, or I was going to pay for this surgery, and that's all I really was to this person. And I have to, sure, there may be some exceptions where maybe there's a doctor that pushed somebody a little too soon, or was trying to meet their bonus, or something like that. And I'd say the same thing about physical therapy practices, just to be completely fair, and every other kind of medical procedures out there. They're all working to make some money. That's how we make our living as healthcare professionals. But what I think is important is to fully educate each individual on their options. And what I personally believe, based on my stance in the healthcare and the people that I know, is that surgeons don't know about the kind of stuff that I'm telling you about, because most surgeons, this is important, most surgeons deal with physical therapists that help people after surgery. Think about it. If you go see a knee replacement surgeon, I bet almost all the physical therapists that they know specialize in helping people after surgery. So when they have somebody that doesn't want to have a surgery, a knee surgery, and what they're ethically supposed to do is refer that person to physical therapy if appropriate, or give them medications. Of course, that's what they do. But then if they go to physical therapy, and the physical therapist they know is one that says, I don't really know what to do for this torn meniscus unless they get surgery, and I know what to do then. Or I don't know what to do for this person that has severe arthritis, their knee doesn't really bend very well, but if they have a knee replacement, I can help them out. The thing is, physical therapy clinics don't think like this most of the time. They're business. So they see everyone and anything that comes in the door that they can remotely treat or that they're good at treating because they need to fill their clinic to make money. So you have to do some research. You have to look around. If you walk into a physical therapy clinic and you see a bunch of people that look like they just had surgery, they're usually older, of course, and you just talk to the therapist and tell them, what do you see most here of? They're probably going to say, oh, knee surgeries, back surgeries. If you hear surgeries over and over again, that clinic probably specializes in seeing people after surgery. And I taught at a university. And so what I can tell you too, as a professor at a physical therapy school, is that the graduation level, the level of skill of a entry level physical therapist is that of being able to handle somebody after surgery. Meaning that's what physical therapists are trained for. I went through extra training on top of that to be able to help somebody prevent surgery. It's a whole different specialty, which requires a different skill set, a different way of thinking of things. Just like a medical doctor would finish medical school and then go to surgery residency or neuro or pediatrics or whatever specialty they want to family practice, or they just stay general sometimes too. It's the same thing with physical therapists. It's just not talked about or well known as much. So I digress. That was kind of a lot. Let me finish these comments here. I get passionate about that stuff. We just need better knowledge out there. Tamika McCoy says, right. And then Miss Sharon says, are there lots of risks with hip replacement surgery? Great question, Sharon. They're the same. The risks that I talked about are the same for hip replacement surgery, and the benefits are going to be the same, which I'm going to go into next. So let's talk about the top 3 benefits of getting surgery for your knee or your hip, as Miss Sharon wants to know. Number 1 is pain relief. Especially if you have a joint replacement. If the source of the pain is coming from the joint itself and they replace it, they cut out the ends of the bone and you put metal parts in there, then theoretically you should not get pain afterwards. So hopefully you get pain relief if you have a joint replacement. The thing is, there's still nerves that come over the skin. There's still muscles up in the hip, ankle, and foot that influence this. So it is possible for people that have had knee replacements like Jude to still have knee pain. And it's possible for people that have had hip replacements to still have hip pain as well. It happens all the time. Going back to my point of, you got to treat that root of the problem. But if you have that severe type of knee arthritis, then it's probably going to benefit you a lot to get a knee replacement. If you have a massively torn up meniscus and you've tried to address it naturally, might help you out to get some sort of meniscus surgery. And there's things for cartilage surgery as well. There's surgeries for cartilage injuries as well. So let me go on to the next part. The next benefit is going to be increased mobility. And what I mean by that is, if for your knee, if you can't bend or straighten your knee all the way because of the knee injury that you're suffering from and you're looking at getting a knee surgery, there's likely a good chance that you're going to increase the range of motion that you have. Of course, it depends on how well you heal afterwards. Any sort of complication, keeping up with exercises, physical therapy, those things are important to maximize the motion that you're going to gain. And as a result of that increased motion, theoretically, you should get more mobility as far as walking around to do stuff as well. So think about that too. All right, number 3, and then we'll take any questions and we'll start wrapping up here soon. Number 3 is this could set you up. Getting a surgery could set you up to help fix the root problem. Now, going back to the root problem issue, in other words, like the strength, the imbalances, the muscle imbalances, if you have a massive loss of motion and you cannot exercise because your knee doesn't straighten out or bend very good, then maybe getting a knee replacement is a good idea so that you can work on it. So what I always tell my patients that come in here that have had, like Jude, that have had a knee replacement surgery and they're still having pain in the same joint that they got replaced. I tell them, you got to fix the root problem. It just never got addressed. Hopefully the surgery that you had was the right thing to do. Either way, it's done. You can't go undo it. You can't get your old knee back anymore. So let's fix the remaining problems that you have, which might be for you, your foot strength, the arc in your foot needs to be checked out. Your ankle mobility needs to be looked at, and the strength of the muscles that support it. Maybe there's some issue in your back or your hip. Maybe butt muscles need to get stronger. Abdominals could be a factor here. There's many, many things to look at. But if you have the joint replacement, at least you remove the joint stiffness and the loss of range of motion as being a factor contributing to your knee pain. And now you can exercise more confidently without worrying that that knee problem is going to slow you down. So that's another benefit to getting a knee surgery. So that wraps up my top three risks and top three benefits of getting a knee surgery. So I want to open the floor for questions here. We have just under 5 minutes left, and then we'll wrap up. So going to the comments here, Tamika McCoy says, can you suggest any PT places or persons in the New York City area? I do have friends over there. I can't think of them off the top of my head, like the names of their practices. So I'll have to drop some in the comments later on, Tamika. If we don't get to you here in the next, like by 5, so it's 4:30 where I'm at, or 4:26. It's going to be 5 o'clock in about 30 minutes, 34 minutes. Just drop a comment on this video and we'll see it then, and we can get you that information. And then you also said, Tamika, why don't PTs and weight loss doctors work more together? Fantastic idea, Tamika. I think that should happen. Nutritionists as well, because they just go together. Plus, they're not they're not quick fixes, which is what I always tell people is surgery is a quick fix. It's a passive procedure. You just show up the day of surgery, you get knocked out, anesthesia, and then you wake up with a replaced knee or with the surgery done, whatever they were going to do. And yeah, you still have physical therapy to do afterwards, but it's kind of like taking a pill to a degree, right? You just take a pill and it does its thing. You fall asleep and then the surgeon does their thing. It is a much more challenging. I think this is why we're not on national television right after the pharmaceutical industries showing their commercials, because it requires active participation from the individual more than just swallowing a pill or signing off on the paperwork that they're going to have a surgery. You have to do the exercises and you have to learn. You have to do it right. You have to figure out which muscles are supposed to work, which ones are not. You might have to go to recurring doctor's visits, physical therapy visits, not just show up a few times, then have your surgery and then show up a couple more times to the doctor's office and that's it. It's kind of involved to do this kind of stuff, just like weight loss. I mean, every time you eat, you got to count the calories or make a plan. You have to figure out what you're going to eat. You can't just eat on a whim and say, what do I feel like eating right now? Because you know it's not going to work. If you're having an emotionally tough day, guess what? You're probably going to go get some not so good food for yourself. So it's that I would love to see that relationship strengthen more, Tamika. I think that would be of tremendous benefit to everyone, to the people of our country, the people of our world, if it was just a normal thing for them to work together. But as of now, it's just not. So that's why. Jude has some questions here. POTS is postural orthostatic tachycardia. That's right. Okay, so in other words, her heart rate increases based on her posture. And then Jude says, do the glute exercises that Dr. David shows, they make lots of difference in calming the pain. Yeah, I that's why I put them up. I think glutes are a key to many knee problems. If you have knee problems, chances are your glutes don't work. And if you go try glute exercises and you feel your quads working or your hamstrings working or your back muscles working, you definitely have a glute weakness. And all those other muscles that are firing are the compensating muscles. And you need to figure out how to fire those glute muscles because it's going to help out your hip or your knee, even down into your foot and ankle and up in your back as well. So just watch out for what's affecting your knee problem. That the root of the problem is a big deal. Starting out with the glutes is not a bad idea. So what I always tell patients in the clinic is, look, at worst case scenario, if you strengthen your glutes, you're going to have to deal with the side effect of a more toned backside. That's not too bad, right? Versus having a joint replacement surgery or any kind of surgery, you're going to have scars and all the recovery that comes afterwards. And I don't want to get into it again. It's a headache. All right, guys, I'm going to start wrapping up here. Thanks so much for joining us, everyone. Tamika McCoy says, POTS sounds scary. No, it's not too bad. I mean, it can be in some cases, but it just means you have changes in heart rate related to your position. I've had a lot of people suffer from changes in heart rates related to positions. That doesn't stop them at the end of the day. They just have to be careful with how fast they move, how fast they change positions. So it's not too bad. All right, friends. Well, I hope you like this video. Give us a thumbs up. And if you know anyone, if you're watching this on the replay, if you know anyone that needs to hear this, please share it with them. It's very useful information for somebody that's really contemplating having a surgery because they may be able to avoid it and do the right things to recover. We've had so many people comment, like Jude here on our channel, that have had success with strengthening the right muscles, and they're essentially saving themselves tons of money, tons of emotional trauma, physical trauma as well, and improving their quality of life simply by getting on the right exercise plan and doing the right things, getting the right strategy behind what you're doing to address your knee problem. So please share this with them, and we'll see you in the next video, friends. Bye bye. Have a good one.